Hi, my name is Anaya Randall, and this is my project on botulism or Clostridium botulinum. So for morphology and gram status, it's rod-shaped and bacillus, single cells, pairs or short change, a gram stains positive, and it's endospore-forming bacteria, oval and subterminal. First, its life cycle, it forms spores, and forms dormant spores. Then, when a spore encounters favorable conditions, it will germinate and become active living bacterium. Then it grows and multiplies exponentially through binary fission. And as favorable conditions deteriorate, the bacteria begin forming new dormant spores. Those get released, and then the cycle starts over. You can find it commonly in soil. It can survive indefinitely in soil because it can handle a lot of different environmental factors, and soil contamination can lead to human exposure. You can also find it in water, marine and freshwater sediments. Spores can be mobilized from soil into water bodies through rain or dust, and aquatic decomposition of organic matter in their environments creates ideal anaerobic conditions for botulinum to grow and produce toxins. It is a rare but severe disease. Global reported cases are on the order of about 1,000 per year. Case fatality historically is about 5 to 10%, but is decreasing, and it is shown that there are hundreds of US cases per year, mostly infant botulism. Like I said, infants are highest risk, less than 12 months. People who ingest improperly home-canned, under-processed, low-acid foods. People with contaminated wounds, like drug users. And it is rare for inhalation botulism to occur, but people who are at risk are in laboratory or aerosol exposure. The famous outbreaks in Sacramento with nacho cheese drip in 2017, 10 people were found ill and 1 death was reported. This map shows regions where Clostridium botulism is found, so we can see that it's very widespread almost everywhere in the world. There are a bunch of different types. You can get it through food or ingestion of the neurotoxin in food, infant or intestinal, which is the ingestion of spores, and found in the intestinal tract. Wounds, open wounds spores germinate in them and produce toxins. Inhalation is rare, but aerosolized toxins can cause disease, and it is not traditionally transmitted person to person because spores are environmental. An example of someone getting foodborne botulism is having home canned greens beans that aren't pressure produced, creating anaerobic conditions to permit vegetative growth. The toxin is then produced. The family eats the beans. 12 to 36 hours later, the family has cranial nerve palsy and descending paralysis, and then a hospital cluster and public investigation is occurring. This diagram represents transmission from the spore to the person of all the different ways, and then lists some symptoms. Botulinum neurotoxins, or BONTs, are the major virulence determinants. There are 7, A through G. Types A, B, and E are most found in human disease. They block acetylcholine release at neuromuscular junctions, leading to paralysis, and the spores enable persistence in environments, but toxins can cause disease. Infection pathway entry is ingested, or germination of spores or wound contamination. Colonization or production is vegetative growth in anaerobic environments. It is released crossing guts or enters circulation, binding presynaptic nerve terminals, endocytosed, and translocated to cytosol. Immune evasion in action. Its enzymatic cleavage of snare proteins prevents acetylcholine, and nerves cannot signal muscles, causing immune response to be comparatively low. And then the disease and tissue damage, functional neuromuscular blockade, cranial nerve palsies, flaccid paralysis, respiratory failure if diaphragm is affected. For immunology, there's innate, where the BONT is acting extracellularly, it is not neutralized, and spores resist innate killing until germination. There's adaptive, where antibodies are directed against BONT, passive immunization occurs, and then there's immune evasion, where Spores are dormant and resistant to immune clearance. This diagram represents antibiotic resistance. So we see that penicillin and metronidazole is used for wound botulism. Encephalosorphins are not standard, but can use for botulism across the board. And then antibiotics are usually avoided for infant botulism. Some resistance mechanisms include other anaerobes, altered targets, but widespread resistance is not found. And then MDR is not a major clinical problem, but species have been documented, so it remains critical. Some drugs used are HBAT, an antitoxin for non-infant botulism. Then for infants, they have Baby Big, both passive ways of preventing the treating botulinum. And then we have penicillin and metronidazole mentioned previously. Some experimental therapies, small molecule inhibitors, vaccines, supportive therapies, regeneration, immunoglobulin therapy for baby pigs is standard. This diagram represents what it looks like when the antibiotic is attacking the toxin within the cell. The disease is named botulism, and then there are the multiple types that we've went over. Organs affected is the nervous system, muscular junctions, eyes, face, swallowing. Then it goes to the respiratory muscles of the diaphragm. This diagram on the left represents all of those symptoms that you would see. And this image on the right shows an infant with botulism experience the muscle paralysis. For signs and symptoms, the incubation period for foodborne is 12 to 36 hours. Infants can take days to weeks, and wounds are variable but days to weeks. Early symptoms, blurred vision, dry mouth, generalized weakness, constipation. Some severe ones are the paralysis, respiratory muscle issues, and autonomic instability. If untreated, we have respiratory failure, which is the most common cause of death for this disease, prolonged hospital stays, and secondary infections. This diagram represents all the individual places where humans are affected or where botulism can show up, and then this at the bottom shows what's happening inside the cell. For course of disease, we know the incubation period, then recovery rate versus mortality rate. It's about 5 to 10% survive, or mortality rate, most patients survive. And then in most cases, it requires ICU level care. And for infant botulism, they require prolonged hospital stay. For treatment, standard protocols is contacting and going to the hospital. Antibiotics aren't preferred to be used, but can. And then for babies, they have Baby Big. For wounds, it's usually surgical antibiotics. For foodborne or infant, it's not used. Supportive care measures include support with ventilation. This is a CDC flyer about how honey is not safe for babies because it contains the infant botulism causing disease microbes. Some preventions, there's no vaccinations that are routinely used or not widely used. And then safe home canning is used, avoidance of honey for infants, early recognition, and supportive care. And then a fun fact is that botulinum toxin is potent and it causes paralysis, yet tiny amounts are used in Botox.